Okay,
Go
do you
ahead.
want to give your opening remarks there?
Okay, I will. Thank you. It is requested that participants introduce themselves every time they speak. Roll call votes will be taken for every action item. This meeting is also being recorded for minute-taking purposes, as well as posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Thank you.
Thank you, Marcin, and good morning to everybody. This is my second opportunity hosting this meeting of the Health Equity Outreach and Consumer Experience Advisory Committee. So I think we're all familiar with who I am and one another, but just to mention it again for anybody who might be new today, I'm the acting healthcare advocate and recent appointee as the chair of this committee. So welcome again, everybody. Before we do introductions of the Access Health and other folks who have joined us, Marcin, can we take a quick roll call of the committee members?
Yes, Mr. Chair. Sean King, Chair.
Here.
Deb Poland.
Here.
Cheryl Taubman. Giselle Carlotta McDonald. Somebody just joined. Leslie Greer.
Here.
Holly Hackett. And Gerald O'Sullivan, who's a subject matter expert from SID.
Here.
Thank you. Somebody just joined us. Can you just announce yourself?
Sheldon Taubman, Disability Rights Connecticut. Good morning.
Good morning, Ms. Taubman. Thank you. That concludes
Good
our
morning.
attendance list for the committee members.
All right, thank you, Marcin. And next, I thought I saw James here. James, good morning and welcome. If you wouldn't mind introducing yourself and your team, or having them introduce themselves.
Is James on the call?
I thought I saw James earlier. Maybe he just hopped off again.
Yeah, I don't
Yeah,
know.
Sean,
Who would like
I
to
think
take the
James
lead?
mentioned he had a conflict, but there's
Yeah.
Oh, okay.
I'll take-
several of us here.
Yeah, I'll take the lead. I'm Tammy Hendricks. I'm
Okay.
the Director of Health Equity and Outreach.
I'm Caroline Rouette, the Director of Marketing at Access LCT.
Susan Rich Bai, Director of Legal and Governmental Affairs at Access Health CT.
And I also have some team members. If they don't mind introducing themselves, that would be great. In the Health Equity and Outreach Department.
Hello, good afternoon.
Outreach Manager.
Hi, everyone. This is Louis Cerizari, Community Outreach Supervisor.
Ellen Laramie.
Justin York, Outreach Coordinator.
And again, Karen Perez, Community Outreach Manager.
Thank you very much.
All right, thank you, everybody. Moving forward through the agenda this morning, the next item is public comment. I understand, Marcin, that we do not have anybody who requested to make comment this morning.
That is correct, Mr. Chair.
Okay. On to review and approval of the meeting from September 28th, 2023. I will entertain a motion to accept those minutes. Any of the committee members want to make a motion? Did everybody get it?
Ms.
Okay, I
Greer?
didn't catch who it was. That was
I
Ms.
think-
Greer. Is there a second? I'll go ahead and second. Any discussion?
I need to abstain from this vote. I wasn't on the committee at the time.
Okay, we'll note Deb's abstention when we do a roll call vote.
Mhm.
Any other comments or changes or additions to the minutes? All right, hearing none. Marcin, if you'd take a roll call vote, please.
Sean King,
Yes.
Deb Poland,
Abstain?
Sheldon Taubman. Mr. Taubman. You're on mute, sir.
Apologies. Yes.
Thank you. Giselle Carrera McDonald. Leslie Greer
Yes.
and Holly Hackett. Thank you.
Okay, that motion carries. Next item on the agenda, we have an update from the Department of Social Services. Do we have a DSS staff member who's gonna go through today's updates?
Yes, my
Yes.
name's oh, sorry. I don't
Go
know which
ahead.
one I don't know which one we're doing first. I think it's NEMT, so I'll let you go first, Yvonne.
Oh, okay. Good morning. My name is Yvonne Pilato. I'm the NEMT Non-Emergency Medical Transportation Contract Manager for the Department of Social Services. So good morning, advisory committee members and guests, and thank you for inviting Donna and I today. And I just wanted to share a general overview of our non-emergency medical transportation services, key utilization indicators, some metrics, and an overview of our outreach program. Next slide, please. So in Connecticut, the Department of Social Services oversees the NEMT program, including the overall design and implementation and contract management in line with federal and state Medicaid requirements. Next slide, please. The department partners with a single entity, a transportation broker, currently MTM, to manage and administer the Connecticut NEMT transportation program. And that would also include improve the collection, analysis, and reporting data of our delivery service. Next slide, please. The Medicaid program pays for NEMT services for eligible and enrolled Medicaid members to travel to non-emergency medical services, which are covered under the Medicaid program. And the general coverage categories include Husky A, C, and D, as well as under the waiver, the 1115 waiver for Covered Connecticut, which is our newest coverage category. Next slide, please. So under the waiver, the Covered Connecticut waiver, the Covered Connecticut program provides NEMT services along with dental services for members who are enrolled in a qualified health plan and are eligible for services under the Covered Connecticut program. I think Donna will talk a little bit more in her presentation about Covered Connecticut. So the overarching program goals for DSS, and that includes NEMT, follow and are guided by the Centers for Medicare and Medicaid Services Triple Aim. And they are improving the patient experience of care, including quality and satisfaction, improving the overall health of populations, and reducing the per capita cost of healthcare. I wanted to share some of the NEMT mode mix inclusions. So we have public transportation, we have mileage reimbursement for use of personal vehicles. We have transport by taxi, livery, or sedan. We provide transportation by wheelchair as well as bariatric wheelchair accessible vehicles. We provide transportation for ground and air ambulance service transportation on a limited basis and stretcher vans. Next slide, please. Here I wanted to share some data about monthly unique membership that was served in a 10-month period, and that was from January through October of 2023.
So as you can see, we started out in January with around 15,000 unique members served, and that climbed steadily to approximately 22,000 members served in October, by October. Next slide, please. So correspondingly, the call volume also increased over time, and it ranged between 65,000 calls to 100,000 calls that were answered by the brokers' call center representatives. Next slide, please. This is monthly trips completed over the same time period. And that range was between 150,000 to approximately 200,000, 230,000 completed trips. Next slide, please. This is a summary of the same period, but a summary of the entire year of monthly trips completed by specialty visit. And you can see here that drug rehab and behavioral health and specialists, as well as dialysis, are the top 4 utilizers for monthly trips by specialty visit. Next slide, please. So as part of the DSS NEMT continuous process improvement work, we are also in the process of initiating and planning and initiating and implementing, actually we have implemented that, an outreach and engagement program. And our program objectives for this outreach and engagement program is to increase member and provider and other stakeholders' knowledge of NEMT services that are available within Connecticut, to enhance member accessibility to NEMT services, to improve service delivery and member experiences and satisfaction, to reduce fraud, waste, and abuse, to identify areas in need of improvement, to collect internal data, analysis and reporting to inform policy and operational decision-making. And for that purpose, our target audience, of course, are first and foremost our Medicaid members, our healthcare providers, healthcare facility administrators, and general stakeholders across the various rural and urban regions within Connecticut. And we do this by conducting site visits to various facilities, specifically methadone clinics, dialysis centers, and medical clinics, extended day programs for school-age children with behavioral health challenges. We work in close collaboration with our ASOs, such as CHN Connecticut, Carillon, and Benecare. We have also partnered with the YMCA throughout Connecticut, and we will be working with them throughout this year to spread the word about NEMT and also the service provided under the Covered Connecticut program. We conduct satisfaction surveys to elicit feedback from our members, and we've also developed a brochure in English and Spanish that gives the program descriptions of the NEMT services for our members, answers frequently asked questions, guidelines and requirements, contact information, and information on member portals, mobile apps, and facility portals. So the overall goal for the outreach, NEMT outreach program, is to improve the efficiency of services by delivering the best customer service experience that we can, reducing the causes of ride cancellations, by members and member and provider no-shows and the incidence of complaints and positive resolutions. The value proposition and the aim is for our members, and we are hoping that we will accomplish improved access to NEMT services, and provide independence and convenience for members, financial respite for members, improve health outcomes, and enhance overall customer satisfaction. Next slide, please. So on this slide, we just have some more information about Covered Connecticut and the Covered Connecticut demonstration. If you are interested in learning more about the Covered Connecticut waiver, you can go to Covered Connecticut demonstration. And for more information about the program eligibility, enrollment, benefits, and events, you can go to Access Health CT, which is the Connecticut's official health insurance marketplace. If you are interested in learning more about the DSS non-emergency medical transportation program, you can directly contact me at this website, yvonne.pilato@ct.gov. And thank you so much. I'll be happy to answer any questions before we move on, and I'll turn it over to Donna. I see Sheldon's hand is up.
Yes, hi. Thank you, Yvonne. I wanted, you left out the part about how Veo was acquired by MTM. So the contractor, I guess, was been 3 years that we've had Veo. They were bought out by a large national NEMT provider called MTM. And my question is, there's no, I think most everybody probably at this meeting knows that there have been huge problems with the quality of the services through Veo. I mean, it's been really pretty terrible. Question, I believe that the formal legal acquisition of Veo was on August 1st, and then the official takeover for Connecticut was September 1st. Maybe you can correct me on that. But since then, it's now been, say, 4-5 months. Have the number of complaints you've received changed, with that changeover starting then or whatever it was?
Yeah, thanks for that question, Sheldon. The transition period began on September 1st from Veo to MTM. And I would say that the first 3 months, September, October, November, were very difficult months. There were a lot of platform changes, behind the scenes changes that were not as, in retrospect, should have been piloted by MTM instead of rolling it out. There were some very difficult challenges for members to be able to schedule. There were challenges with members and facilities being able to schedule for their members. Since then, and we did get a lot of complaints, and I think we're at a point now where we've stabilized the system and we're working towards, we're getting better results. We have met with Hartford Healthcare on a regular basis. We continue to do that. We've met with IOL and their affiliates. We've met with the Wheeler clinics. We are making sure that we are in daily contact with the quality management team at MTM and the leadership at MTM. So the numbers are starting to look much better than what they were in the beginning of the fall.
Thank you. Could you share with us whatever data you have on the complaints and as you say, and hopefully that's right, that it's getting better. Can you share data on that?
I don't have that with me at this moment, but I can certainly send it to the group.
I think I would appreciate it. I suspect others would appreciate it as well. Thank you.
Sure.
Any other questions for Yvonne? Yvonne, I had the one thing that caught my eye was the increasing monthly trips and call volume and unique members who had called and received rides, trending upwards at a time when I believe, due to the unwinding, our Medicaid enrollment is decreasing. And so I'm wondering if you have any information about what might be driving those trends.
I think Connecticut actually did lots of preparations for the unwinding. And compared to other states in the nation, we actually have done a very good job with the unwinding process, preparing and implementing and continuing to do it on a monthly basis until this spring. So I think that there was not a lot of negative fallout from the unwinding as it relates to NEMT services.
No, I maybe I didn't state my question clearly. It looks like despite the numbers of enrolled members coming down, we're getting more and more members who need NEMT services. And I guess my question is, do we know what's driving that that inverse trend? And if we don't, then it would be helpful to maybe look into that a little bit.
Okay, so are you referring to the large call volume on that one slide?
The three graphs indicate that there are more calls, more rides, and more people needing rides, even though there are fewer people enrolled over that period of time. There are fewer people enrolled in the Medicaid program. So you would think that if there were fewer members, there would be fewer needs for rides, but it's the opposite. So I'm kind of wondering if we have any indication as to what's driving those trends.
Yeah.
Or am I not looking at it correctly? But I think I'm.
Yeah, I think one of the on the monthly call volume, for example, when MTM switched over from VEO to MTM in September, the call volume went up tremendously because as they were trying to implement and change over to their platforms, where previously people were able to schedule their appointments online, they had a lot of technical challenges with their platform transitions, where members could schedule, facilities could schedule online, reoccurring appointments or a single appointment. And so they had to call the call center. And I think that's where a lot of the difficulties arose with the high call volume from the latter part of the year once the transition began. Now they've got some of those kinks worked out on the technical side, and people are utilizing the platforms in a much better way. But yes, I will check into that.
Okay. Appreciate it. Thank you, Yvonne. Deb
You're
has a
welcome.
question.
Yeah, actually more of a comment. I'm wondering if part of this is because these are the total calls answered, not necessarily the total calls that actually went to the call center. And so could it be that the call center just got better at actually answering the phone calls?
So these were calls answered by a representative.
Yes, exactly. So it could be that some of the calls back earlier in the part of the year, people were waiting on hold and gave up, and that call never got answered.
That's correct.
Any other questions for Yvonne? Try to keep this moving along. Sheldon had a
Sorry.
follow. Yep.
Sorry to be a pest, but on the call center thing, am I correct that the contractual requirement is 80% of calls? I think it was 80% of calls have to be answered in 3 minutes. That's
That's
the
That's
correct.
correct, Sheldon.
So do you have data on that? The thing Deb was just raising a very good question about. Do you have data on that in the period, like throughout last year, including after the transition? And I mean, not taking that time now, but just generally, has there been seeming compliance with that requirement?
There were several months where they were not in compliance with that, particularly in September and October because of the transition.
Okay, thanks.
You're welcome.
Okay, seeing no other hands up, let's we'll keep the meeting moving along, and I'll turn it over to Donna to cover the covered CT dental benefits. Take it away, Donna. Donna still here? Donna, if you're talking, I think you may be on mute.
Can you hear me now?
Yes.
Okay, I am so sorry. I had to reboot my computer. I lost connectivity and I'm at the office today. So my name is Dr. Donna Belosky. I have overseen the Connecticut Dental Health Partnership since before its inception in 2008 and had overseen dental benefits when they were part of the managed care program. So we had a good idea of, how to develop the benefits for the Covered Connecticut program. When Covered Connecticut came along, I was very ecstatic to see that oral health was included because we all know that oral health is a very important component to overall health. And for years, it's kind of been the stepchild of benefits. If people need to know how to qualify for NEMT or dental benefits, this is the website that you can send them to, and it outlines the conditions they need to meet in order to qualify for the Covered Connecticut program. One of the things they have to be in is a silver plan or greater to qualify for benefits. Next slide, please. This is a copy of the cards that people will have. Benicare, the dental vendor for the Connecticut Dental Health Partnership and for Covered Connecticut, is responsible sending out for the welcome packages, which has a letter, explains the benefits, and it has their Covered Connecticut card. They can also go online to get these. We send out a big mailing every month based on the enrollment from AHCT. We do get some that are returned to us. It's usually less than 50, for a bad address or person is no longer available at that address, but we do reach out to them, via other means, phone and email, if we do have that available. Next slide, please. Okay, what do members need to do? Well, after they qualify for the program and are enrolled in Covered Connecticut, they need to go to connectcct.org. That will explain their benefits, what they're entitled to. They can locate a provider. It tracks their dental utilization, and they can also call our membership services if they don't want to go onto the website, and that's 855-CT Dental. And that works for both for the Connecticut Dental Health Partnership and the Covered Connecticut program. Next slide, please. Okay, what are the dental benefits? Well, the dental benefits for children and adults are slightly different. They are robust and improved. Children are considered 21 years of age or less, and adults are 21 years of age and older. So the 21st birthday actually is the demarcation line, for that. And as I said, there's a little bit of a different benefit package for children than adults. Next slide, please. Okay, the dental benefits for adults. In the past, we had this reputation of not having access. There was low provider participation and reimbursement. With the event of the Connecticut Dental Health Partnership in 2008, which was a result of a class action lawsuit, our pediatric rates were significantly increased, and our dental rates were also increased a bit as well. 2 years ago, we also increased our dental rates by 25%. Today's reality is much, much different. We have a very robust network for both pediatric and adult patients. We do have some constraints with appointment availability, especially out in the eastern portions of the state and the northwestern portions of the state, because there are just not a lot of dental providers available there. We do a lot of outreach to our members who are non-utilizers of dental services, because we do believe in the significant importance of oral health, and we do a lot of work with our special healthcare needs populations. One of the things that we feature that many other programs don't feature, we keep track of offices that have capabilities for bariatric accessibility, people in wheelchairs. There's some offices that do sedation services that other offices don't do. So we can pretty much tailor a person to, their special healthcare needs if they need that. And we use the NEMT transportation to get them there if they also need that too. They might have to travel a little bit more out of what we have as a 20-mile range, but we can get services for all people who are needed. Next slide, please. And this is a map of our geographical location of our providers in our network. And as you can see, they're really centralized around Naugatuck Valley and the central portion of the state. I have the outliers that you see on the top right and the top and the right side, which are our out-of-state border providers. I couldn't fit it in the slide to include on the left-hand slide, but we do have providers in the New York side of the state. Most of our members have access within 20 miles, and of course, we don't have any providers located within the Long Island Sound. Next slide, please. Okay, what are the adult dental benefits? The adult dental benefits have a cap limit of $1,000, but that is what's called a soft cap. So if somebody has a need for a root canal, additional fillings, for unaddressed caries, anything that they need, we automatically approve that. Things that are not included in our adult cap are such things as, multiple extractions, anesthesia, endodontic therapy, because, one root canal at $800 can really eat up benefits, and our newly added benefit that went into effect on January 1, which is periodontal benefits, because that will eat up, their adult cap as well. Okay, and then the other thing I want to, emphasize, there's no out-of-pocket expenses for members unless they choose to get services that are not included in our package of benefits. We cover all the basic benefits. We don't cover Ferrari dentistry. And I'll give you an example, and this is an outrageous example. We had somebody who wanted a ruby implanted in her front tooth, and we don't cover things like that. So next slide, please. Okay, pediatric dental benefits are a little bit different from adults in that we cover all the same services, but we can cover more under what's called EPSDT, and that's early periodic screening, diagnosis and treatment services, which is part of Title 19 and part of the Social Security Act. And I can't remember what year it was enacted, but if a child has a service that's needed that's not covered on our fee schedule, it will be covered. And I just had an example of that the other day. A child broke off a tooth. They needed a crown lengthening procedure, which is not normally covered. And, because it's part of EPSDT, we approved it. It wasn't, for a covered Connecticut population person, but it would apply just to the same as to the Connecticut covered population. Children also get orthodontic care where adults are not entitled to orthodontic care, and adults being over the age of 21. Next slide, please. Okay, what are non-covered benefits? Well, I gave you an example of the cosmetic procedure already. Bridge work is not covered benefit. Cosmetic procedures are not a covered benefit. And enhanced services, for example, if somebody wants a cubic zirconia crown, which is not covered on our fee schedule and the provider charges more for it, we don't cover services like that. Like I said, we cover the basic services and, it provides good restoration for people. It puts them back into functional dentistry and functional occlusion, which is the goal of the program. And periodontal services, I'm happy to say it's something that we cover, but it's for people with chronic medical conditions. I'm hoping to be able to expand that to pregnant women and to the entire Medicaid population in the future. Next slide, please. Okay, what do you need to do for treatment? Well, the patients need to go to a Husky Health or Connecticut Dental Health Partnership or Connect CT provider, which is all the same network. We have 2,117 providers in our network currently. We have children and adult, and we have specialists all throughout the state. You have to bring your Connect card so that they can, check your eligibility and verify that the member is eligible for services. And members should be aware that they will be financially responsible for any services that are not covered under the Husky Health Plan or covered Connecticut plan. And, example being putting a ruby in somebody's front tooth because they want it. That is up to the provider, to perform that service and make the contract with the member for that. Next slide, please. What do you need to do with members? You can provide them to the referral to the Connect coveredct.org, cct.org website. And if they have problems with the website or don't feel comfortable or can't access the website, they can always call the Connecticut Dental Health Partnership. It's 1-855-CT-Dental. Pretty easy to remember. Next slide, please. Okay, this is the utilization of claim services. And I want to point out, you see a decrease over the past 3 months because we have a thing called claims run out period. Providers have up to 365 days to submit claims, but we typically find they're at least 90 days behind. I did this data about 2 weeks ago, so I would not expect the November and December to be fully, representative of what we have right now for utilization. But basically, members are using around $150,000 to $160,000 dollars in dental services per month. Next slide, please. And this shows the distribution of the services. Most of the services are preventative, which is great. Some oral surgery, usually people who need wisdom teeth extracting is what I find is happening a lot in the basic restorative and, prosthodontic services. Next slide, please. Okay, we have the Connecticut dashboard, for Covered Connecticut, and this has all kinds of information on that. And this is on the bottom. You'll have to sign up for Smartsheet and do a login and a password with that, but it gives you all kinds of member statistics, including enrollment for the month, member utilization of services, how many welcome kits were sent out, how many prior authorizations were sent in and approved, I believe that is on there, and what types of services people are getting, categorized by service and category. But like one of the things, root canals would be all under one thing under root canals, but we'd break out different services like apicoectomy or, other types of endodontic services that are available to clients. And it gives a lot of good, useful information. We've been collecting this since the inception of the program, and I think if you take a look at it, you'll find it very beneficial. We do a lot of work in terms of health equity too. We outreach to our non-utilizers They do get robocalls, saying, you're enrolled in the program. We see you haven't utilized benefits. You have these benefits available to you. If you need help or assistance, call us. We also help with translation assistance. One of the things that we see, and it's not necessarily from the covered Connecticut population, but it's the large amount of people who have come in, with refugee status as immigrants and, from Afghanistan and other Arabic countries. And we see a lot of Parsi and, Dari being used. Our other big languages are Spanish, Portuguese, French, and Albanian. And we do have materials available in all those languages too, if people need it. And I'd like to put in a plug for this month. This is Children's Dental Health Month. If you can go to the ctdhp.org website and take a look at Dr. Tooth Fairy, you can listen to some pre-recordings in 5 different languages and, see some of the materials and blogs that we are hosting in their educational blogs and instruct people on the importance of good oral hygiene. Okay, can open up to any questions if you have any.
All right, thank you, Donna. I saw that Susan had her hand raised pretty early in her presentation, so I'll let Susan go first here.
Oh, thank you so much, Sean. I just wanted to clarify, at the beginning of the presentation, Donna said silver or higher. It's not that to be in Covered Connecticut, they have to be enrolled in a silver plan because at their income level, they're eligible for a CSR plan, and you have to be in a silver plan to get that. And the other thing I just wanted to mention is that our qualified health plans that the Covered Connecticut population is enrolled in provide pediatric dental benefits. And due to a change in a law by the state of Connecticut several years ago, even though under the ACA, pediatric dental goes to age 19, the state of Connecticut changed plans, any type of plans covering pediatric dental and vision benefits to extend it to age 26. So our qualified health plans that people are enrolled in for Covered Connecticut provide that pediatric dental benefit up to when the person turns age 26 as well. So there's a bit of overlap, in the population that's enrolled in Covered Connecticut versus the dental benefit through the Department of Social Services, and then also this pediatric dental benefit that's available up to age 26 through the qualified health plan. So I just wanted to make sure everybody was aware.
Thank you for that too. I do want to let you know though that we do have some children who are enrolled through Covered Connecticut because they don't qualify for other means. So enrollment has looked into that, and it was some unusual circumstances. It's a very few number of children, but we do have a couple in there. So.
All right, thank you. Thank you both for that clarification. Sheldon, you had your hand raised.
Yeah, thank you very much, Donna. Could you please go back to the slide that listed what you said were not covered benefits for dental?
Sure. I'm not driving the slides, so.
Oh. Yeah, that one. So my questions are is this about the dental specifically in Covered Connecticut, or is this about the dental benefit for straight Medicaid people?
They're one and the same. When the waiver was written, it said it would mirror exactly what Medicaid is.
Okay, then this is where I have a problem. And I'm sorry to have to say this, but when you declare absolutely that bridge work and implants are not covered, period, that runs up into a problem under federal law. States that choose to cover a dental program under Medicaid, that they can't exclude entire categories of accepted non-experimental treatments, and bridge work and implants are now covered.
I agree with you, Sheldon. I should have phrased it and said typically they're not covered. We do have reasons for medical necessity where we will cover them. So
okay, this is really important.
Yes, it's just not very often, but we do have reasons, for medical necessity that they will covered. we don't cover from them for everybody who wants to come in and have implants for lost and missing teeth. It's not necessarily the right means to go.
So the question is medical necessity, and that's fine.
Uh-huh.
But it's really a problem when you put a slide out here and say this is the rules, when that's not true. It is typically not covered, but people can and should request prior authorization when their dentist believes that something is medically necessary. I would hope that you would correct these slides going forward for all presentations, both to MAPOC, here, wherever, because, and the reason I say this is important is that I have heard from many people that they're told by their dentist that something is absolutely not covered. And when you see a slide like this, it gets reinforced. So I'm
Thank
sorry to be
you.
harsh here, but take it back. I would really appreciate it if you could fix these things going forward.
Thank you, Sheldon. I appreciate the feedback. Yes.
Okay. We're a little behind schedule here. I don't see any other hands. So, Donna, thank you for the presentation. That was very helpful. A lot of good information there. I'm going to move on to our open enrollment 11 update, and I'll let Tammy give us that summary. Thank you, Tammy.
All right. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. Switching gears here, I know that we are running short on time. I'll start off with some key open enrollment metrics. I'm presenting on behalf of our Technical Operations and Analytics Department. So for any specific questions, I'll bring that back to Rebecca and get a response for you all. But it's been an extremely successful open enrollment for us, actually the most successful just in terms of enrollment and other factors. We'll start off with the call center activity. Since November 1st, our call center, T-Tech, has handled over 260,000 phone calls and 24,000 chat sessions. This is about a 15% increase in calls and 21% increase in chat sessions compared to last year. And of course, a majority of this increase can be attributed to the Medicaid unwinding process. And so we've been working really closely with T-Tech to ensure that they're adjusting staffing during that time. And we continue to work with them to go through the unwinding process closely. This year, we have 129,000 individuals enrolled in a QHP as of 1/15, the end of open enrollment. This is a 20% increase over last year and our highest actually volume to date. The previous high for open enrollment was our third open enrollment, and that was 116,000 enrollees. So also to continue with that increase, the number of individuals enrolled in Covered Connecticut nearly doubled to over 27,000 individuals at the end of 1/15. And that's about a 25% increase. Oh, wait, 25%. Yes, 25% of whom did not have a QHP coverage in 2023. So that was some acquisition there. We've seen an increase in dental enrollment, about a 55% increase. So we are approaching 14,000. And for reference, prior to integrating the dental into our system, our enrollment peaked at 4,500 individuals. So significant increase in dental this year. This year, we've seen a 10%, just over 10% of our health plan enrollees are now enrolled in a dental plan. And so those numbers continue to grow. And I'll keep moving down here just to highlight some points. For the Medicaid unwind, during the Medicaid unwind, the enrollment increased over 92%. Of course, this is primarily due to the increase in redetermination for the unwinding process. So significant increases on that end. In terms of the Medicaid unwind activities for outreach, That will continue. We have 2 additional fairs that we are planning over the next 2 months. We will continue to have our navigator sites doing enrollments, and we will have enrollment specialists that will continue to rotate and do enrollments at these navigator sites. We have monthly Healthy Chat presentations continuing for consumers. These are general presentations that consumers can learn about plan options and where to get help to get enrolled. And we will continue with our monthly partner presentations. Again, just keeping our community partners updated every month on any changes, and so that they can help the consumers that they serve. So I know I rushed through that. I'm happy to take any questions.
Thank you, Tammy. Sheldon has a question.
Sheldon?
Sorry, I'm such a pest. A follow-up question on a theme, which is the call center, especially during the unwinding period. What's the contractual requirement for the Access Health call center as far as, timeliness responding, and has it been complied with during the unwinding period?
Sheldon, I can tell you that we've been working very closely with them, but I would have to get that specifically from our Director of Operations, and I can provide you with that information.
If you could, that'd be greatly appreciated. Thank you.
Absolutely. Thank you for that question.
All right, seeing no other questions, it's time to move to the leaver survey. I'll just note that we have about 7 minutes left on our scheduled time. So if the last presenters could just speed it up just a little bit, we might run over just a little anyway. So I think this is Caroline is going to give us an update on the leaver survey.
Yes, and noted. I will do my best to be as concise as possible. Caroline Ruette here, Director of Marketing for Access Health CT. I'm going to provide a quick overview of the leaver survey findings. Leaver surveys, by the way, are conducted to help everyone understand why someone may have left and we're not yet in.
Okay. There she is. No, we may have lost her.
Sorry, you're freezing up, Caroline, on the screen. I don't know why.
Yeah. My apologies. Just a quick reminder, leaver surveys are conducted to help people understand why a customer may have chosen left a product or a service. In this case, we studied why people were leaving Husky Health when they no longer qualified for Husky Health and where they might be getting coverage as a result of Medicaid unwinding. So more specifically, what did we learn? 3 quick things. If consumers had health coverage and how they got it. Second, why some consumers did not have health coverage. And third, if consumers knew about the Husky redetermination process and what they needed to do to retain coverage. In terms of how we conducted this survey, we partnered with an independent third party, Market Street Research, to develop and administer the survey. It was conducted online and over the phone in both English and Spanish between the time period of November 6th and December 4th. The total population surveys was just over 24,000 folks, and that would be people in households containing at least one person whose Husky coverage ended between May 1st and October 31st and did not have active enrollment in the Access Health CT system as of November 1st. And we got about 700 responses of the folks that we surveyed. And we can move forward to talk about some high-level findings. Next slide, please. All right, so here's the top reasons why people left Husky Health. First of all, not surprising here and really great to see that data, 35% of the survey respondents had coverage through an employer. 29% were currently uninsured, and the rest of the report and some of what we'll talk about on the next slide is what we're going to do about this particular population. 12% reported other, and I want to be very clear with what that means. People might have had coverage through school, the military, through VA or TRICARE, directly through an insurance carrier, if they went directly to a carrier, or even participated in a healthcare sharing ministry. Should also be noted here that a sizable portion of the population here, 11%, actually aged out and were eligible for Medicare. And a good portion of folks also had coverage through a partner, a family member. And there was a portion of this population that also moved out of state. Next slide, please. In terms of that 29%, the folks that were uninsured, we really wanted to understand what was behind that. We heard a lot of things. Some of those are bulleted here, but vast majority of them were directly related to cost. Cost was the biggest barrier as to why people were going uninsured if they no longer qualified for Husky. Next slide, please. In terms of what we're doing about this, some key findings was making sure that we leverage all available options to make coverage affordable. That means making sure that we provide a range of plans, and by promoting that financial assistance is available through Access Health CT. We also need to continue to drive awareness about redetermination, but it should be noted that more than half of respondents indicated that they were aware of the redetermination process via a state agency, as well as the impact of not taking action. And so I want to just congratulate the folks over at the Department of Social Services as well for being part of this communications effort. And then lastly, we know we need to expand outreach to groups that are less likely to have healthcare coverage. Nearly 40% of the uninsured folks indicated that they do not understand health insurance and therefore find it difficult to sign up for coverage. So we know we need to keep doing what we're doing that's successful from a standpoint of combating health literacy issues, but we know we need to do more, and we are actively working to figure out how we can go ahead and kind of increase those health literacy related efforts that we have. So recognizing we don't have a lot of time. Any questions that I can verify for folks out there?
Any questions or comments? I had a couple that I hope are just real quick answers. You got about 700 survey responses out of 24,000 plus.
Yep.
Was that statistically significant, or is that is it possible that we have a rather large potential for outliers?
There always are potential for outliers. This is, a survey response, but it does fall within Market Street Research's suggested pool of information in order to be statistically significant.
Okay, and then for those who still are uninsured for one of the many reasons that were given, what opportunities are left? I mean, I guess at this point for them to enroll in coverage if they don't qualify for Husky. Open enrollment's over.
Right, open enrollment
still some
is
flexibilities?
over.
Yeah, go ahead.
So when they lost coverage, they had 120 days in order to elect coverage, and that is going to continue on. Medicaid unwinding isn't done, so we're still going to see this kind of similar situation happen for folks who are being affected by unwinding now and as we close out the unwinding process. So we're really focused on communicating out to those folks what their opportunities are. If somebody that we surveyed at this given point in time chose not to take advantage of that 120-day special enrollment period window or opportunities throughout open enrollment, it's possible that they would need to wait for the next OB cycle.
And Caroline, this is Susan. Sorry, Sean. I think what we had in the whole study also said that for some of those that are listed as uninsured, some of them actually are waiting for employer-sponsored coverage to kick in. They may be in a waiting period after they started a new job. So.
Correct. Looks like we have another question.
Holly has a question. Yep.
I'm sorry. I know we're going over time. You had said that there is an issue with people not understanding insurance coverage and things like that. That is a real issue because I know specifically of one case. So if there's one case, there's many more where a plan was given to this person. They did not understand what it was and what it wasn't, more importantly. And when I read all of the instructions, I'm like, yeah, no, you get 3 visits for the year. And then it says you're only covered up to 70%. That doesn't mean you will be covered up to 70%. So when you're going forward, I would really like to see people being more educated and told more specifically what their plans will entail instead of them just being given the deck sheet. Well, that's car insurance speak. But I think it's really important to give people what they're getting for their money, more so on the phone and or in person than just to say, hey, here it is. This is what you requested, when in all actuality, it truly is not.
So we agree with you that all types of help are really important, which is why Access LCT is committed to providing free assistance. And we do provide that over the phone, as well as in-person events where people can really kind of go through that benefit to understand what they get. And at our in-person events, I'd just like to remind folks that we have brokers there. We have certified application counselors, and they do just that. They do help people understand that. We know that's not enough and we need to do more. And we're working on figuring out exactly how we can address this better. It is an industry-wide problem. It is not just specific to Connecticut, but we know we can make a difference and we are committed to doing that.
And I'd just like to add, Holly, you know, we do monthly sessions, healthy chats, we call them, and they're specifically for consumers, teaching them about plan options. And so if you know of people that would benefit from that kind of information, we do it on a monthly basis. The information is on the website. We are taking more steps towards health literacy for sure. So we agree with you on that.
Thank you. I appreciate it.
Of course.
All right. Thank you, Holly, for the question. I'm going to turn it back over to Tammy to go quickly through the Broker Academy update as well as the community outreach update.
Yes, I'll be very brief. Not a lot of changes. We're moving into our 3rd year for the Broker Academy. Very exciting. Basically, we're seeing an uptick in engagement all around. We have more visits to our website. We see that based on the Google Analytics that we're getting visitors from all over the state. So the word is definitely getting out. Important to note that we are opening applications up for March 1st, and they will close on the 31st. We plan to accept 80 students this year, and it will be split between 2 class locations. We are still deciding on the class locations, but based on the uninsured data, Hartford, of course, historically has always been kind of number 1 in the state, but Stamford is closely following at number 2. So we're looking at possibly Hartford area and lower Connecticut area for the class locations. One other change for the program this year, we'll continue to have a 5-day in-person class, but this year we're only going to cover health, and which will be covered in 3 days. This is going to really allow for people to get a review day and to prep more for the state exam, rather than squeezing the health and the life courses together in 1 week, which can be overwhelming for a lot of students, especially those who haven't been in school for, you know, a decade or 2. Until they've gotten into the program. So we are offering the life as a virtual option for students who still want to pursue that. But during the in-class days, we'll just cover health. So that's a change that we've made this year. Hopefully it will help with the state exam and getting students through the state exam process. Another change is we've added additional time to the mentorship portion of the program, which is always important. We want the students to have some hands-on experience. So hopefully with those changes, we'll see an increase in the number of students who complete the program and pass the state exam, which is our main goal. We do have info sessions also coming up, and that can be found at the link listed on the slide. Any questions on Broker Academy? Sorry, going quickly. Okay, and to round off the meeting, just some highlights on our outreach activities. You know, I talked a lot about the open enrollment numbers, and the same could be said for outreach. We've had significant increases in our events attended by our teams. We had a very targeted outreach plan last year, and it was seemingly successful based on the numbers, based on our feedback. So we've seen a 21% increase in our events last year. We've seen an increase in our total site visits to community partners, which is very important for us building those relationships in person. Our overall reach is a gross estimate. This is just from the events that we host, and we're estimating we've reached over 3,000 people in person for our consumer and community partner interactions. Another important note is we've increased the number of certified application counselors last year. That was like a 69% increase, which was significant. And we've also seen an increase in the number of organizations that want to participate in that program, which is also great as well. And rounding out with open enrollment numbers, we saw a 19% increase in our visitors, right? We get the hardest cases in person, and so we saw an increase in that number. We had more fairs to compensate for that, giving people more time to come in and get help in person. And we saw a 31% increase in enrollments at our enrollment fairs and locations. So all great things happening. And I'll pause here if you have any questions, and I'm happy to send more information, and Sheldon, I will follow up on that call center information that you requested earlier. Oh, we got a
Deb,
question from Deb.
Question. Go ahead.
Thank you. I know we're up against time, but this is really important stuff for our committee. And I'm just wondering, you know, what you learned this open enrollment that you want to carry forward to next open enrollment the same, and what you think we need to change.
Yeah. So this year I didn't touch on how we kind of re-energized our enrollment fairs. They were more like resource fairs. And so we brought in a lot of our community partners, a lot of hospitals, Hartford Hospital, Yale. We had a lot of community partners participate at our enrollment fairs. And so while folks were waiting and you know, in between getting enrolled, they were able to tap into other resources from the communities. So that's something that we will definitely carry through. And that's an important part of it in health equity, right? Health insurance is important, but other basic needs need to be met for folks to really have the opportunity to take their health more seriously. So we had a cell phone company there. If they qualified for Medicaid, they were able to apply for a cell phone and other technologies. So bringing more resources to the fairs that we have, really important moving forward. Our outreach plan was always based on data. So we follow the uninsured areas, and that's where we ramp up. But I think over the past year, engaging with our community partners on a more consistent basis, every single month we were meeting with them, whether it was site visits, whether it was a virtual the virtual meeting that we do and we give updates. We increased the number of regional planning meetings and in-person events that we had that gets all the community partners together. So that's something we definitely want to move forward with. And that was significant during the Medicaid unwinding period as well, keeping everyone updated, solved a lot of issues on the back end. Did that help, Deb? I'm sorry, I rant on and then I forget.
Good question. Thanks for the question, Deb. Thanks to Tammy and Caroline and our other presenters today. This was all very informative, helpful information. Thanks for taking the time to put it together. I appreciate everybody's patience while we ran over time a little bit today. As a last agenda item, if anybody has any suggestions for our next meeting's agenda, now's the time to share those. And if we don't hear any, I'm sure we will find some things. We will find some things to cover at the next meeting regardless. All right. Hearing nothing else, I will entertain a motion to adjourn.
So moved. Deb
Moved
Bullen.
by Deb. I heard a second. Is there a second? I'll second. Martin, can you call the roll?
Yes, Mr. Chair, Sean King,
Yes.
Deb Poland,
Yes.
Sheldon Taubman, Giselle Colonna McDonald, Leslie Greer, just Greer, and Holly Hackett.
Yes.
Thank you.
All right. Thank you, everybody. Good to see you all. I appreciate your, again, your patience and attention and participation.
Thank
see you soon.
you.
Have
See
a
you all
great day.
soon.
Thank you, everyone.
Take care, everybody.